Now, data from 23 million people in France who've had a COVID vaccine is showing just how effective the jabs are in preventing serious illness and death. The French study finds that people over 75 are 94% less likely to be hospitalized from COVID if they've had the jab. Stats worth taking seriously if you're planning a family reunion at the end of the year. Globally, the data backs this up. Here in South Africa, we are in a lull with our numbers. Latest numbers show real decreases in infections and hospitalizations and also deaths. But we certainly cannot become complacent. Let's speak now to Professor Mosa Moshabela, Acting Deputy Vice-Chancellor of Research and Innovation at the University of KZN. Good evening to you, Prof. It was interesting what the Premier of KwaZulu-Natal said about vaccination rates. And he said that only 29% of the province's people have had the jab. I'm just wondering what the national rate is, because I know that Nicholas Crisp has been very much focusing on those over 60 and 70, because that's the group he's most concerned about, because they're the most at risk. But just break down where we are in terms of provincial vaccination rates versus the national.
Yeah, no, absolutely. Greetings, Sally, and to the viewers. I think that listening to the Premier today, I think his message was very clear that he's concerned that the numbers are lagging behind. He gave a figure of 29% of the target group, and I'm assuming that the target is referring to all adults 18 years and above. You know, that number, of course, it's a little bit higher than what we have currently in terms of the average, which is 25.5% as of yesterday. But when we look at the data from the SA coronavirus portal, KwaZulu-Natal is still at about 23%. So it's lagging behind together with Mpumalanga and Gauteng, even though the population, the numbers are higher. In terms of absolute numbers for KwaZulu-Natal and Gauteng, they're lagging behind in terms of the proportion. So my sense is that there is a need to align those numbers that the Premier was referring to and the ones that we are looking at from the national portal. Nevertheless, I think the message is clear that he's very concerned about the slow uptake of vaccines. He can see that there's been progress with the people who are above 60, whereby the numbers are close to 60% at 58%. But for the age groups that are 18 to 34 and 35 to 49, they are below 13% in each one of those categories. So my sense is that, Sally, his message really today was that we are concerned that KwaZulu-Natal is being left behind compared to the rest of the country. He's concerned about the vaccine hesitancy. He's concerned about the narrative that's created around vaccines in KwaZulu-Natal, and he wants to change that, and he wants to leverage what they've started now as the Vuma vaccination drive.
And then you see studies like the one that's come out from France with a real-world study. It's a massive study, 23 million people who have been vaccinated, and it shows that you are 9 times less likely to end up in hospital with COVID if you've had the jab. And this is millions and millions of people, and the data is pouring in not just from France, but from all other countries who've got very high vaccination rates. And there was a very interesting quote from the French epidemiologist Mahmoud Zurek. He oversaw the French research, and he told Agence France-Presse, an epidemic without serious infections is no longer an epidemic. And that's the point, isn't it? Do you think that we are going to get anywhere close to 70% vaccinations before the end of the year and in time to prevent a fourth wave?
Yeah, so I think, Sally, the study from France is interesting, especially because it looks at their national health system data, which looks at the whole country, and essentially they are providing real-world research and to see the kind of impact vaccine has had in France, and it of course aligns with the UK, it aligns with the US data and many other data that we've looked at. So for me, the message that we are getting there, Sally, is that vaccines are now the standard of care. And it's about time we just accept that and we don't debate that. Perhaps the question then might be, as you say, the nuance around who benefits most from the vaccine. I think it's very clear that at an individual level, it's important to make sure that people who have risk factors, those who are older, above 60 and 50 actually, and those with comorbidities really need to be vaccinated. And in that way, you deal with one problem, which is really reducing severe disease and death from COVID-19. And in that way, there is a degree of control. But ultimately, I think that we must also not stop striving to make sure that once we have overcome the issue of severe disease, as we have seen other countries like the UK and others who have managed their recent surges of infection in terms of increased infection, but very limited mortality, limited hospitalization. We want to see that, but we must keep striving to make sure that the coverage really goes up.
Absolutely, and thank you so much for chatting to us this evening, Professor Mosa Moshabela, Acting Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal.